Welcome back to the Afterword, a conversation about the future of words. We are so glad to have Dr. Eric Brenner and Kim Nelson here with us to continue our conversation about the stories and language we use to talk about public health and epidemiology. So what are some of the key myths that you run into when you talk about public health and development projects?
I remember when the pandemic started, even the WHO, they said, well, we may have a twin-demic. At that point, they didn't mean both COVID and influenza, although that could have been what they meant. They meant an epidemic of the virus, but an epidemic of misinformation. And I think one of the words they used was info-demic. That would be an epidemic of misinformation. I thought maybe it should be misinfodemic, but I thought infodemic is pretty good. And we've heard so many interesting, sometimes frightening and upsetting myths. For example, I had a letter from someone recently saying that they had heard that the COVID vaccines could alter your DNA, and therefore that would be very dangerous to take. Also heard what other kinds of myths? Oh, I know that the virus was developed not by the Chinese, but by Bill Gates, so that big pharma can sell us lots of vaccines. It's actually the pharmaceutical companies that have made this. And other people have said, well, COVID doesn't really exist. You know, all these deaths. There are always people who die every year in the US. We're just counting deaths which would have occurred anyway as COVID deaths. It takes some appreciation of vital statistics and how death certificates are managed and how they're counted to know that that's wrong. But those are some of the myths that we've been getting. So it brings us back then to some of the issues we discussed in the first part. A lack of education and critical thinking. I believe in some countries, even in France now, part of the curriculum in schools is learning to assess information and where it's coming from. And that's something that we'll have to do to fight these infodemics for sure.
Yeah, I think most people generally have no idea what public health is or does. And the truth of it is that it is such a broad field that pinning it down on one thing is really tough. And like Dr. Brenner said, especially, because we are existing in a pandemic and a pandemic that was heavily politicized too, we do see a lot more misinformation, a lot of kind of identity politics at play. People choosing whether or not they're going to comply with public health recommendations and mandates based on their political affiliation. And that's kind of new. One thing I frequently see is, why are we upending our lives for a virus that 99.7% of people are going to recover just fine from? And one, it's like, is that even the correct statistic? But two, to me, it's horrendous. Why wouldn't, these are our friends, these are our loved ones, this is our community. Why wouldn't we minorly inconvenience ourselves with a mask to protect the people who live and work here and make this place what it is? So that's kind of my hill to die on, this public health. You don't go into it for the money, you go into it because you care about people. You care about making things better. You care a whole lot. Otherwise, you'd burn out. And seeing that kind of callousness in our fellow countrymen, in our political leaders, telling elderly Americans to go die for the economy, that is just not something that will ever, I will never stop being mad about that, I think.
Well, I appreciate both of the unpacking of some of those myths, and it is interesting, when you think about a myth and how it starts. And I like that new word, infodemic. I really appreciate that. But Kim, you mentioned on our previous episode a little bit about when public health's going right. Nobody knows about it because it's doing its job. It's just like, my car. I don't know anything about the engine of my car. I want to get in, turn it on, and have it take me to where I need to go. But when something goes wrong, then I'm panicking. I don't think about that engine unless there's something wrong. And I think that's what I have seen right now with our pandemic is we have something wrong and everything has been exposed. That's not such a bad thing because sometimes when something's exposed, we can fix it. So let's talk about some of those positive things, those success stories, Kim, that maybe we don't think about anymore. And I know Dr. Brenner alluded to them a little bit with the 1999 reflection of what we've done correctly in public health. But give us another success story, Kim.
Well, I'm going to go policy. So we are finally talking about things like whether or not you should have paid sick leave. We're in a caregiving crisis in this country. Why are we not supporting our caregivers who keep the entire economy running? Like, let's talk about the role that school plays in all of that. Teachers are not babysitters, and yet parents cannot work if schools are not open. So we are seeing a lot of those kind of cross sections of our life here. And we're finally having some conversations that are long overdue because, like you just said, COVID, I wouldn't say it necessarily created new problems. It just shone a big spotlight on all the problems that were here. And we were just kind of, duct taping it together and crossing our fingers and hoping it worked. Very similar to your car analogy. That's how I've seen many friends fix their cars with little duct tape here and there. Some of the success stories coming out of that are that we are talking about, in the stimulus bill, the fact that we are supporting people with children. We are alleviating some of that financial burden because the cost of daycare is astronomical. Greenville County, I'll use our example. If you have a child under a year in Greenville County, if you can even find a spot in a daycare, you're looking at $1,200 a month. That is more than my mortgage. It's not much better if your kids are older until they get to elementary school, really. And, you want your kids to be safe. You want to feel good about the people you are entrusting with your child's life. So we're looking at things like why are daycares, which are charging $1,200 a month, only paying their staff $7.25 an hour. How does that happen? Well, because of things like the insurance they have to carry. And, they're not taking that big chunk of money home. So maybe we should pay daycare workers more. Maybe we should open eligibility to things like Medicaid for our caregiving population, because a lot of times they are excluded from it. So all of those things, I think, are hopefully going to be what we come out of all of this with, that sense of valuing women's work, number one, realizing the importance of protecting having that safety net when things go horribly awry, because they will, and they do. It might be a pandemic. It might be a natural disaster. It might be an economic collapse. We don't know how, but we know that they will. And doing nothing is not an option.
Very helpful perspectives. And when I was thinking about public health stories, public health success stories, but the history of health and public health is sometimes has had disasters, such as what we're having now, and sometimes great successes. And I'm wondering if it would be useful to remind people that we've had pandemics before. Sometimes people who studied history know about the Black Death, from the Middle Ages, for example, cholera pandemics that we had numbers of times over the years, the great influenza pandemic of 1918, which our grandparents, no, I guess that would be our great grandparents would have lived through. So the world has been through pandemics before. It's a reminder that since we've been through a number of these and we're having one now, this could happen again. That maybe is another topic for discussion. But some of the events that have affected the world have been great success stories, since that's what your question was, Amy. And one of the best success stories is the global eradication of smallpox. And people under 50 years of age don't even have any memory of this, or under 60. Smallpox, over the centuries, killed countless millions. And then something remarkable happened in 1966. Russia, or actually in those days, it was the Soviet Union and the USA, during the height of the Cold War, said, all right, we don't have to fight about this. We have a tool that, if used properly, might let us eradicate, not just control, not just eliminate, but eradicates smallpox from planet Earth. And it actually was done in 11 years, from 1966. The last naturally occurring cases occurred in 1977. There were just 2 or 3 other people after that who got smallpox from a laboratory accident. And then in 1980, WHO said, all right, we actually have done this. And the reason that success is important is that it shows what can be done with international cooperation. Certainly that's an issue now, because some of your listeners may know that in the previous administration, there had been talk about the United States withdrawing from WHO. When the new administration came in, one of the first things they did was to be in touch with Dr. Tedros, who's the Director General of WHO, saying, don't worry, we are not leaving, we are in. And that great success story of eradicating smallpox was led by an American, Dr. D.A. Henderson, an amazing story. So important, because in the past, everyone used to get a smallpox vaccine. Now, Amy, are you old enough? Do you have a smallpox scar on your arm? What year were you born in, Amy, if I might ask?
No, I can't go on our podcast with that one, Dr. Brenner. We'll just talk about the story that smallpox has been eradicated.
Smallpox has been eradicated. That's right. But you'll find older people have a little scar on their arm, as I have. So the vaccine was widely accepted then, and that was a tool. Actually, when people said, all right, smallpox is gone from the USA, we don't need to give smallpox vaccine anymore. Pediatricians were so upset because they were used to giving smallpox vaccine to everyone. And it's a long story, but they did stop, but it was still went on. And eventually the last few countries in the world had smallpox eliminated. That's a wonderful success story for us to keep in mind.
It's a wonderful success story. And I agree. I mean, we actually used when we were talking with our guests on vaccines, that was one of the things that they were talking about. But it is interesting because even then there were anti-vaxxers came to the surface. So, we can overturn that. We can also look forward to the future. So thank you so much for those success stories.
Are you seeing any technology trends in public health, either globally or domestically?
Well, several. First of all, laboratory diagnostic tests have really improved tremendously. And that's why we have, just with the new virus, we have had tests to detect viral RNA quickly. Then we've had tests to detect antibodies, so we can know who is protected. In the old days, this would have taken years to develop. All this came out very, very quickly. We've had new technologies in terms of the new kinds of vaccines that have been made available. I was mentioning before, people afraid that COVID vaccines would alter your DNA, because they've heard that the vaccine has some of the vaccines, like the Pfizer one, is an RNA vaccine, but RNA is different from DNA. But before then, we had killed vaccines and live attenuated vaccines, but now there's a whole new technology, new ways of putting something into your arm that will let your body develop antibodies. So that's been a big help. Computer technology has helped also. Let me give an example. In the old days, when a doctor or a hospital was going to report a disease to the health department, because every state has a reportable disease list, which by law they must report, whether it's measles or tuberculosis or HIV. They had to fill out a little card by hand. Actually, what they usually had done, they would have typed that information into their hospital computer, then recopy that by hand, then mail that to the health department, where someone would then retype the same information into their computer, which had already been in the hospital's computer, 5 days ago. But the technology nowadays, you can have one computer system talk directly in real time to another. So here we are talking on Zoom and whatnot and chatting with each other. But some of the same technology has really improved disease surveillance tremendously.
Kim, do you have anything you wanted to add to that?
No, I think public health broadly is leaning into how we consume technology. Everybody's got at least one social media account. And although it is clunky in how we communicate on social media as public health professionals, it is there. So that's a muscle that we definitely need to keep developing. But, we have apps for things like emergency preparedness. We have, these rapid alert systems. And those are really cool, especially as, we're in South Carolina. We are fast approaching hurricane season. We just went through a weather event for the whole state. I don't know how things are in the low country at this very moment, but hopefully that storm system is settling down. But the fact that you can get an alert on your phone to let you know about a flash flood on your road, those are really, really great tools that were, inconceivable just 30, not even 30, 20, 15 years ago. But here we have all of that information at our fingertips right now. And we just need to keep figuring out and understanding how people use technology and then, figure out a way to reach them with it.
That's a great answer. And I love Eric's word about disease surveillance. That's a fun word. Kim, when you're talking about the technology, and I know even now they've put out a vaccine finder app so that you can, find this. But, we've talked a little bit about that link between public health, human rights. So let's talk about that just a little bit, because I know we could probably do an entire episode just on that alone. But Kim, you've talked a little bit about women and the workplace and that type of thing. Let's dive a little bit about the connection to public health and human rights globally and nationally.
Yeah. So in the U.S., we have the 10th Amendment, and that grants the rights for public health to be enacted through the states. It basically says that's what gave states the right to enforce mask mandates or require vaccines. In the case of vaccines that you need for schools, Mississippi is a famous example, and it's one that we hold up a lot in vaccine advocacy as a state that does not allow religious exemption. And, we're a country that protects religious rights, protects religious liberty, sometimes for good or ill, depending on how you want to look at it. And here in Mississippi, which is arguably a very conservative state, especially in 1979, they decided that they not only would not allow one particular man to get a religious exemption for his child, they decided that religious exemptions were actually a violation of the 14th Amendment for other children. And the 14th Amendment is equal protection under the law. And so that's kind of that balance when we're talking about public health. We have to protect everyone without infringing on one particular group's rights. And that can be a tough balance, when we're talking about disease surveillance, which I'm sure Dr. Brenner will, share with us his expertise. But, how do you make sure that you're letting a community know there's an infectious disease in their area without singling out a single person and ostracizing them or, opening them up to potentially violence or, what have you. So, we have a big, it's a tightrope to walk for sure, and making sure that everyone is safe. But, the government has an obligation to all of us, regardless of whether or not we want to wear our mask.
Well said.
Yes, I was struck by your reference to the Bill of Rights, because when you talk about human rights nationally, so that amendments to the Bill of Rights and other amendments to the Constitution are very important. But this is also a global issue. Globally, the World Health Organization was founded after World War II, I think around 1948, and they have a constitution also. And in the U.S., we have started out with 13 colonies, now have 50 states, and WHO has about 192 or 3 member countries, and they have a constitution also. One of the first sentences in the Constitution, I will read it to you, says, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So I think this is very interesting. So talking about not just physical health, I have a broken arm, can I have a cast, but also mental health and also social health, something we discussed before, and not merely the absence of disease or infirmity. But then WHO also says the enjoyment, and this has to do with human rights and health, the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being. This is really extraordinary. Without distinction of race, religion, political belief, economic or social condition. So some people find this, say, oh my goodness, WHO is overstepping itself. Who says we have a right to be healthy? But of course we have, as Kim mentioned, the Bill of Rights, the first 10 amendments there. What do we have? The Emancipation Proclamation was the 13th Amendment. 19th Amendment granted women the right to vote. So we have lots of history of having rights in our society as well. What WHO says also is that unequal development in different countries, and this is something we're facing in this country where we have people who are underprivileged or economically disadvantaged, often don't have access to the same kind of care. WHO takes us to the global level, says unequal development in different countries in the promotion of health and control of diseases, especially communicable diseases, is a common danger. Is that interesting? So there's a right to health. And if people don't have that right, that can be a danger then to other, not just other individuals, to other countries, especially for dealing with communicable diseases. That's exactly what we've been experiencing this last year. So it's fascinating to make this link between health and human rights.
Yeah, we've seen it play out, unfortunately, so clearly. And I love how you all both brought the United States amendments and the World Health Organization amendments together and educated us a little bit on those. Excellent, excellent points. Thank you so much.
We have one last question that, as word people, we like to ask everyone to talk about. And that is, what's a metaphor for helping us understand how public health works?
Let me play with that a bit, and then let Kim play with it a bit. We've had a couple of, we've spoken about the term public health a lot, also the term epidemiology. And although we've spoken about it, we haven't really clarified. We spoke about epidemiology, what the word's origins was. But if you break down epidemiology, I'd say using epidemiology to understand disease is child's play, because it just tells you what disease you're talking about, how many cases there are, how many, when they occurred, where they occurred, who is it affecting, and why. That sounds like something that you teach elementary school students. How many? It's all the W's. Is that right? When, where, who, and why. That's epidemiology. But A metaphor for public health. How about this? To see its own public health, society just needs to look in the mirror. You see what I mean? Because then you can really see what's happening to yourself, and are you looking at a society which is healthy? Look at yourself in the mirror.
Well done.
Okay, so let me jump in before Kim gives her metaphor. That'll give you a few more seconds to think. If you need them. Putting COVID aside, is our society a healthy one? If we looked in the mirror, what would we see?
Duct tape.
Is that your metaphor, duct tape?
No. Well, no, my metaphor is public health is like a family where public health is mom. You know, mom makes sure everybody's got their homework done. Mom makes sure there's groceries. Mom makes sure dinner is handled and school uniforms are ready and permission slips signed. And then mom gets sick because mom didn't take care of mom. And now it's chaos. Nobody knows who's doing anything or where anything is. That's kind of how public health functions in our country.
Wow, those are beautiful metaphors. We've got a mirror and we have a family. And maybe we can get the family to look into the mirror in a healthy way and change and grow as a result of what we've experienced in this pandemic without the duct tape, as Kim so succinctly used. That's never going to go out of my mind.
I've been well educated. Amy, are you going to enroll in an MPH program now?
Probably not, but I'll be honest with you. I'm probably going to continue doing some of the things I've learned as I've listened to these guests tonight. And wearing a mask in public is probably going to be one of my fashion statements going forward. I just am probably not ever going to not want to wear a mask.
All right. Well, we are nearing the conclusion of our conversation on the words and stories behind public health and epidemiology. We've had two fantastic guests, Dr. Eric Brenner and Kim Nelson. Eric, where can folks learn more about you or connect with you?
Same way you can learn about many things these days is by going to Google. And if you would type in Google Eric Brenner Public Health, that'll take you to a couple of spots, the most important of which is my USC School of Public Health faculty webpage, which has a CV and a biosketch and other information. So just come back to Google.
Awesome.
I just did actually while you were talking. Kim, what about you? Where can listeners connect with you?
Oh, wow. Well, if you Google me, you're going to find a whole lot of campaign stuff. I have a very big digital footprint, for better or worse. And you'll see some sassy tweets. Those can be fun, but I'm not on Twitter as much anymore now that the campaign's over. But every now and then I need my outlet. So my Twitter handle is @Kim, the word for FORSC. You can also find me on Instagram that way. I'm not on Facebook. I took the plunge. I broke up with Mark Zuckerberg and I have no regrets. So
I haven't done it yet, but I'm on my second of 3 books now about how social media is killing us, essentially. So I have a feeling I'm going to be at least socially distancing here before long.
But how podcasts can do things even better than social media. So congratulations to you two for taking the time and effort to organize these sessions. Bravo.
We learned so much.
Thank you.
We're excited to connect our listeners to this great information.
Et je dirais aussi bravo pour Kim.
And speaking of folks who
Nous
listen,
allons parler en français après.
we want to let people know that next week we'll be talking about water and how we can support clean and accessible sources for water sources for every community, both in the U.S. and abroad. And in the meantime, Amy?
Why don't you leave us a review if you've listened to one of our podcasts, rate us on Apple Podcasts or Google. make sure you're a subscriber to the afterwordpodcast.com because it does help keep the conversation going. And as always, please remember you are welcome at our table.